Most babies are accidents. Not me. I was engineered.
In vitro fertilization. Project done by Aneisha Lopez. In vitro fertilization is commonly referred to as IVF. IVF is the process of fertilization by manually combining an egg and sperm in a laboratory dish. When the IVF procedure is successful, the process is combined with the procedure known as embryo transfer, which is used to physically place the embryo in the uterus. In a process called insemination, the sperm and eggs are placed in incubators located in the laboratory, which enables fertilization to occur.
We'll be inseminating the eggs. We either inseminate them by putting sperm around the eggs or by putting actually just one sperm inside the egg, and that's called ICSI.
And you make that decision based upon medical issues?
Based upon their medical history, based upon a male factor or really the egg issue as well. And a lot of patients do have this ICSI. About 60% of couples in the United States end up with ICSI as a method of fertilizing the eggs. But really the day after the egg retrieval is the important phone call.
Yeah, I remember that.
Yeah. Because the day after the egg retrieval, we'll find out how many of the eggs actually become embryos.
In some cases where fertilization is suspected to be low, intracytoplasmic sperm injection may be used. Through this procedure, a single sperm is injected directly into the egg in an attempt to achieve fertilization. The eggs are monitored to confirm that fertilization and cell division are taking place. Once this occurs, the fertilized eggs are considered embryos. The embryos are usually transferred into the woman's uterus anywhere from 1 to 6 days later, but most commonly it occurs between 2 and 3 days following the egg retrieval. At this point, the fertilized egg has divided to become a 2 to 4-celled embryo. The transfer process involves a speculum which is inserted into the vagina to expose the cervix. A predetermined number of embryos are suspended in fluid and gently placed through a catheter into the womb. This process is often guided by ultrasound. The procedure is usually painless, but some women experience mild cramping. In some instances, multiple pregnancies can occur. In the movie My Sister's Keeper, the oldest daughter was diagnosed with cancer. Neither parent were possible donors for her, so their doctor suggested that they had another daughter to use for spare parts. By using in vitro fertilization, the family is able to make sure their second daughter has the right blood type for her sister. The movie discusses the issues with morality of using one daughter to save another, and whether or not it is okay to have a child for spare parts. Thank you for watching my presentation.